talk now then to Tony Stein, the Chief Executive of Healthcare Management Solutions. They run a large portfolio of care homes. Welcome. Thank you for joining us. So what impact then is this ambulance strike having on care homes?
Morning, Joanna. Well, as always, these strikes are designed to create disruption, and that's what they do. We also have to bear in mind as well that these strikes are happening at a time when ambulance services are stretched anyway. So under normal circumstances, we're experiencing delays for collection of residents and so on. So it is creating additional pressure. Care home operators have all of us are facing the same problem. So we've put additional protocols in place. So, for example, knowing that we're probably going to be waiting longer for the ambulance pickup, we're putting staff onto increased observations, making sure that they're continually updating the emergency services as to the condition of the resident that might need to be picked up, and taking observations, so to make sure that the situation is not deteriorating. So it puts a lot of additional pressure on staff. I
was going to ask you about that. I mean, how much pressure is it putting on them, and what are the concerns around the welfare for the residents on that?
Well, obviously the welfare of the residents is our primary consideration, and you've also got to remember that the staff that we have build very strong bonds with our residents. You know, that they become almost like family. So knowing that somebody needs hospital care, it does increase anxiety for the staff who are working and looking after those people, and knowing that they should be being picked up. And obviously we've got to keep the families involved and understanding what's happening and keeping them up to date. We do talk to local GPs if we need additional help, so that does help us. You know, we can source information and assistance from our GPs. But yes, it's not a great situation. If you can imagine somebody falling in a home with a suspected fracture, you know, lying on a cold hard floor is not the place for that person to be. And, you know, obviously our staff wouldn't want to move that person unless there were extreme reasons why they would need to do that. Now, you know, we've been experiencing across the country, even outside of the strike, you know, very long delays on pickups because of the issue with beds, hospitals being full and ambulances being parked up waiting to discharge. So this isn't just a problem for today. This is a longer term problem that needs to be fixed. But certainly today, you know, there's additional anxiety and worry for the staff.
So what are the lengths of waits that you're aware of?
But we've had waits of up to 12, 13 hours for ambulances in some of our services. And even in extreme situations where we've had emergency teams coming in to help us, you know, waits of up to 4 hours for an ambulance. You know, these are not untypical these days. But as I say, the bigger problem is the fact that you know, ambulances are struggling to discharge, and it's not just, remember, it's not for us. It's not just the ambulance to come and take somebody to the hospital for treatment. It's the ambulance that's required to bring the person our resident who's been in for hospital treatment back to us. You know, that can be delayed as well, and that again exacerbates the problem in the hospitals.
Thank you very much for joining us, Tony Stein.